All right, I'll call this meeting to order. Can I get roll call, please?
Monica Isham, Julia Lyons, Grant Gerber, Mike Markran,
Here.
Mike Waller,
Here.
Lorraine Gouget, Doug Marotek,
Here.
Bruce Poquette, Katie Belanger, John Yackel, Mark Helwig, Elaine Smith, Marshall Savitsky,
Here.
Kathy McCoy, Bill Trepanier. So you need 8 for a quorum.
We are one short.
You have 7. So you do not have a quorum. So this meeting would be informational.
This will be an information-only meeting. We do have a guest here we want to hear from, but let's move on to the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Can I get a certification of compliance to open meeting laws?
This meeting was noticed to the media and the public as required by Section 19.84 of the Wisconsin statutes.
The meeting agenda is set. Are there any public comments? None. Number 8, we cannot do. That would require a 2/3 vote of the majority, and we do not have that. From CJCC. And the same with number 9. They kind of go hand in hand. We would have to change the bylaws down to only one judge. We cannot do that. We will have to wait for next month to approve the meetings or minutes from the meeting. Number 11, the executive committee did not meet. They did not meet. Nope. Jail report.
Thank you. October, we seen an average daily population of 59 inmates, 8 of those being females, 51 being males. Our probation incarceration was at 22, which is 37% of our population. Pre-sentence incarceration was at 19. Sentence incarceration was at 18. We currently have 6 on electronic monitoring. Our population the day that this report was generated was at 58, and our unemployment rate at the time of booking was at 71%.
Thank you. Justice Point.
Thank you. I'm going to keep mine short because I would rather that our guests have more time. So just to go over our statistics, the month of October, pretrial, we had 106 with 2 in referral status. Diversion, 19 with 3 in referral status. 1 was unsuccessful, so that case was terminated. And treatment court, in the month of October, we were at 7, just 7. As far as where we're at with other things, we did have a community event today. It's actually still going on now. They're bread baking at First Lutheran Church, which appeared to be pretty successful. We stopped by there briefly. For the month of November, we have the ongoing SNAP events going on it's the 2nd and 4th Tuesday. It's going well, but we could use more participation, and we talked with sheriff, and I think somebody from law enforcement is going to start attending those regularly. We also have bingo starting in November. That's the last Tuesday of the month. That's at the library. So all of these, flyers have gone out. So there is full information on those. The month of December, we partnered with, or we went to the advisory committee at First Lutheran Church, and we're partnering with them on some of the activities that they're doing, and I can let Kathy expand on those if she wants to, because she knows in depth more than what I could say about those.
It was really nice to have Justice Point come to our meeting. I think everybody on the committee was super impressed, and didn't realize all the great things that are happening in Sawyer County. So it was a good lesson that we need to showcase what is happening positive in our county, because boy, people walked out of there going, I didn't know that. I didn't know. Can they come talk here? Can they come do? It was pretty exciting. So Operation Christmas is 240 families we try to serve. We provide non-perishable food in terms of a big tote, homemade pie from Norski Nook, ham, fudge from Lynn Marie's, apples, oranges, bananas, potatoes, carrots, milk and egg coupons, and a brand new gift for every child in the family. So it's a really huge operation, and we're always glad to have anybody partner with us. In terms of getting referrals to our program, we'll have a call center that's going to open up the week of Thanksgiving. And if you know somebody who wants to get in our program, or if you want to donate to our program or whatever, we have like Christmas trees up where you can take a tree and go buy a gift for a child and bring it back wrapped. We accept donations for food, obviously. Our food cost is going to probably be $16,000 to $20,000 this year, and that's not with the in-kind that we're receiving. So anyway, the more partners, the better. It's 3 congregations at this point. We also partner basically with all the Lions groups kind of are in with us too. So it's just a nice community thing, and we're real happy to have them get the word out and do things like cookies in the jail and that kind of stuff again this year.
Yes, so we're partnering with First Lutheran on that, which our navigators are going to be more heavily involved in. But then also from the jail program standpoint, we take donations from churches for Christmas time, and First Lutheran is a huge donator for that. So that has now started because that is the season. So thank you, Kathy. Recovery Court, we have our very first graduate today, so that'll be at 2:00. He asked, we did ask for the newspaper to be there, and then the graduate said, I would rather that not happen. So we recalled that request. But it is a big deal because it is our first successful completion, and very high hopes and lots of success wished to him. Monday, November 17th, we have our first highway cleanup. As we've been talking about, we have an Adopt a Highway. It's just got put in place. It's on Highway 27 South between Rainbow and Herman Road. So we're going to do that on the morning of the 17th. So anybody's welcome to join us if they want. Just let me know ahead of time so I can get you a vest. But with that, I'm going to conclude so our guests can have. And they are from Rouleau Strategies, working on the Reaching Rural initiative with us. So Tara Kunkel and Chris Bryant.
Hello, everyone. I am Tara Kunkel. I'm the Executive Director of Rouleau Strategies. And yeah. So we've been delighted to work with Becky as part of the Reaching Rural initiative. That's a national initiative designed to support small and rural communities and justice systems all over the country. And we offered to come and just see how you all are doing. We, both Chris and I, this is a fun fact, used to be the staff to community coordinating councils in Virginia. So it's always nice to come to a CJCC. So I want to thank the Sheriff's Office for meeting with us today. We had a tour of the jail and had a chance to peep in on a number of things. And I want to just give you all a compliment. The level of coordination and collaboration that we have observed just in our small time here today is just phenomenal. And I really respect the way in which you all are using data and to lead your discussions, and the availability of data, the understanding you have because of that data is really remarkable. And we don't really often see that. So I want to compliment you on that. We heard many of the same concerns we hear as we go all around the country. The impact of mental health on justice systems is something I think everybody's being hit with. We don't have all the answers, but we do see a lot of people leveraging federal funding. I happen to used to work for a federal funding agency that's trying to get some money out to address that. So that was a common challenge. I was impressed by the way in which recruitment and retention is not so much a challenge within your justice system, which speaks volumes about the culture that you all are creating within your agencies, that you're able to retain staff. So kudos to you on that. Chris, I don't know if you want to highlight anything, and we're certainly happy to answer any questions. We don't have some formal presentation to
No,
give.
and I think Becky had led us to believe that it would be helpful if we came long enough in the morning to get an understanding of some of the major workings of your criminal justice system, but that you may had questions for us around what we may be seeing or what we're seeing in other communities' workings. We weren't sure if that was what you hoped to do at this time, or you wanted us to continue to reflect back what we saw.
You could reflect back a little more, unless you have a question.
We do both.
Reflection, something that really, we were talking about this in the back. I am amazed at the way in which you have lowered your jail census from 2019 to today. And whether that's a result of phenomenal programming, natural evolutions within your community and aging population, I'm unsure. I will reflect back to you that you all have such good data. One of the things you all could consider is really investing in or requesting funding to do an evaluation to really understand what is driving that drop in census, because that's phenomenal and a huge taxpayer savings. So being able to document why that drop has occurred and how your investments are paying off for you is something to consider. I've seen a number of states ask for opioid settlement money to do those kinds of studies, and I've seen in other communities that be quite successful. So it may not be something you have to fund, but something you might want to consider. So that was one observation I wanted to share with you.
What question did you have? Did you have a question?
Oh, does that resonate with you all in terms of opioid settlement money? We do a lot of opioid settlement work.
Less people.
Personal.
What we heard from the stakeholders we met with today, that your pain points, your issues are mental health and substance abuse co-occurring oftentimes, and how your systems are responding to them, and are you getting from that the impact you were hoping to get from the responses to those populations. That you certainly have a certain number of familiar faces that you're used to seeing over and over again in your justice system. And that makes us reflect on or be curious about what is it missing? What could those individuals need that's not presently being provided? And not only are your familiar faces, they're the ones costing your system the most money. So it's not hard to kind of dig into that a little bit and quantify it in numbers. It helps you understand also where the gaps are and possibly what they may need. That doesn't mean your community has to be the end-all be-all for every solution. We talked about that there's some other ways to meet those needs. But at least understanding what those familiar faces may need could be important to you. And then treatment capacity and homeless. Those were the big things we heard today. Anything you want to add to that?
And the aging population, not necessarily impacting your jail or hitting your jail, but we talked a lot about as populations age, you start to see some of those issues around dementia. If they don't have family here, some of that caregiving falls to neighbors or falls to formal county government systems. So that may be, as time goes on, a conversation to have. What can you do to support those individuals as they age? And that's, ideally not your job, but it is frequently people call dispatch. And so it ends up sort of getting integrated into your systems. Going back to the familiar face work, I just want to make a plug. If you want to save money in your system, some of the best work I've seen being done is really to do the math, to look at who has come into jail the most in the last 3 years, get the top 20 names, really put some dollars to that, and then share those names with the other system stakeholders and see what their costs and their touch points were with those same individuals, and then get your best and your brightest in a room together. I'm not promising you that there's these easy wins, but I have seen really smart groups of people get together and really study that list and really work one by one and say, if sky was the limit and we didn't have any restrictions and we had resources and we redirected some of the costs that we're paying to incarcerate them or just have them touch all of our systems, if we did ABC and just dream a little bit, what would be the impact and could we make a meaningful change in some of those lives? So I've seen a lot of good work occur when all you're seeing in your jail is familiar faces. We know that those are generational issues often, but there are sometimes some solutions that smart people can come to if they get in the same room. There's also a lot of grant funding to support that kind of work. So, has anything we said prompted any curiosity?
Do you have much experience with working with youth to maybe try to head off some of those problems?
We talked a lot about prevention work. So I see a lot of people putting their opioid settlement dollars into that prevention or early intervention work. I will confess we are primarily working in the adult system, so I don't know exactly what the latest research is, but that is smart to be spending part of your time working on heading off some of that work. I was pleased to hear that you all are doing some work with children of incarcerated parents. That's where we tend to see the bang for the buck because we're, again, working with the adults. But when you're investing in people who already are at risk, smart. But unfortunately, I'm not your go-to person on the research for prevention, other than to say, do some of that early intervention work. Most of our work is in the behavioral health sector.
So just from a very limited amount of time of being exposed to your system and reading some of the reports that were given to us ahead of time, we can give you some ideas to just think about. That's not to say that they're the right fit for your community, just ideas to consider. So when we're talking about mental health, something that stood out to me that I wanted to make sure we asked is, have all the law enforcement been trained in crisis intervention training? I never asked all that this morning. Has that been something that's been a part of your training regimen?
With our continuing education, there has been quite a bit of training. And of course, with the amount we deal with, there's a lot of on-the-job training and reaching out to see if there's better ways we can do it afterwards as well.
Yeah.
But that's always training is always good.
Absolutely. And the one we see adopted by many communities is that 40-hour CIT, very role-playing heavy training that seems to be adopted at both on the street and in the jail setting. And everything we've ever heard back, even we've been involved on the fringes of them at different times, so positive about. But it's a huge lift on the officers themselves, because for a 40-hour training, there's a lot of recognition of how you're going to cover those 40 hours. There's sometimes a lot of backfill that you have to do to make that happen. So it ends up having to be some kind of priority that has been decided you're going to make sure it happens. We've seen a lot of smaller communities do that through partnering with other communities or at the state level who may be putting on that training, because it takes a lot of man hours to actually put it on itself. But every community we've ever been involved in, on the backside of that, they have said all of that training was worthwhile to them and worth the effort that it took and the time and expense that it took.
Chris has an MBA and I have an MSW, and so we often talk both about where can you have the biggest impact and where can you save money. So my two biggest pitches to you, you have the data. I would love to see you all get a grant or invest in some of that evaluation work to understand, why are we having this positive impact that we're having, and with whom are we having a positive impact, and who are we not reaching? Just to give you, again, another peek into where you have opportunities. I know you all intuitively know it, but being able to quantify those costs is smart. And if I were putting out an RFP for an evaluation right now, I might ask them to take a look at my 20 or 30 familiar faces, who was costing our system the most amount of money. So you can get kind of an objective look at them. We talked about some people in our conversation today, but really understanding what those needs are. I think if you could get some funding to look at those issues, it would give you a lot of opportunity and discussion points here, and maybe some direction to go into. The two other things I would make a pitch for you all to continue to explore is, how can we keep our officers from getting tied up in transport for 9 hours, I think we were talking about, if somebody has to transport to Winnebago. So how can you look at models where you can get those officers back on the street, whether that's a co-responding model? I don't know what you have, what you've considered, what is the norm in Wisconsin, but definitely thinking about how can we keep the sheriff's staff and the police staff where they need to be and get them transported by somebody else. I know that that's very expensive though. And then the more that you can increase your contract hours for mental health in the jail. So we heard about Kevin Lynch, I think is the name of the mental health counselor, who comes in about 8 hours a week now into the jail. If mental health is driving a lot of your returning to custody, and that instability associated with mental health is creating a cycle. The more you can invest in mental health hours at this point, I think you're going to see the payoff. You also have started to make some gains around medication-assisted treatment, but understand that there's some challenges with that around transport and again, all of those extra costs. So looking at, are there funding opportunities so that you're not completely bearing the burden of that at the county level? That would get you perhaps like a MAT officer who's doing that transport. So you keep your core staff in the jail and you pilot and see what the outcome is with those individuals who go on MAT versus those who don't. We work with about 80 jails around the country right now who are all working on their MAT programs, and they all talk about the behavior in the dorms improves, which improves the staff attitudes about coming to work and being at work. So that's besides the positive benefits for the individuals who are incarcerated, just creating a better atmosphere within the jail itself by getting people the medication they need. Huge win there. So those would be my top picks, but I have to say you all are doing a lot that is very, very good. So
You are very, very good.
use your data. I also have to commend, I wrote this down. I was struck by, again, I noted collaboration earlier. But I want to just compliment you, the way that you all come together. Monthly, we heard about a meeting that the sheriff's office has with probation and parole once a month to talk about who's in the jail, who's going to be released, who has a warrant out for their arrest. We don't see that level of coordination, that formal coordination going on. We were impressed quarterly, the sheriff's office meets with the hospital. So much of the friction that we see in other communities is because there's not a good relationship between medical in the community, medical in the jail, and the corrections team. So the fact that there's a formal way to address concerns, to talk about things so they don't bubble up. And there were a number of other monthly meetings, adult protective services. Amazing that there's these monthly formal tables to sit at and problem solve so that you maintain really positive and coordinated relationships. I have to give you a compliment for that. All right, we've said a lot
We
here.
have.
So I'm going to close my book, and if you have questions, we'll be here. You might as well sit down.
All right, thank you.
Thank you.
I was just going to compliment to law enforcement. You guys have been really phenomenal in making a lot of this happen. And I know we even talked about too, now that we're not double bunking, the same thing, positive attitude that for the inmates. I mean, not to have to be in a room with somebody else all the time. And that obviously has been positive, really positive thing once we got our jail population down. And just like medicated assisted programming too, it makes everybody happier when you don't have to share a space with somebody 24 hours a day. So, you guys have been great in working through a lot of these things. So I would just like to say thank you. And one other question though, too, goes back to a long time ago. Didn't the county board have some kind of citation ordinance that they put in place that allowed law enforcement to kind of make the judgment themselves if they stop somebody and let's say they found a joint in their car or whatever, but they weren't really intoxicated and they didn't have anything else going on. I think that citation ordinance addressed that the officers had the leeway to, basically give a citation versus haul them into court, go tie up the court systems, tie up the jail, all that kind of stuff. Is that still in place and are you guys using that at all?
First, I'll say thanks on the compliment. Second, on the ordinance allowing us to have the latitude to do the civil forfeiture process through citations, we do have that. And we are able to utilize that. I think we've probably worked more on diversion and deflection with them on that avenue rather than pursuing that civil forfeiture process. But it is another tool that we're able to utilize. So it is there and we can and do use it, but not as much with deflection and diversion now.
So deflection allows the officer, that the whole premise behind pre-arrest deflection is to allow that law enforcement officer to have that discretion whether they're going to make that arrest or not. And if they determine not to book an arrest, that's where our navigators come in for that
intervention.
That's good to know. So basically this is in place, but you've added to that as an additional safeguard. So there's another check to go through the system, but we still have the ability to do that. So I think this has been a really good thing. And I know there was a lot of discussion when this first happened, but all these little things are just one more piece of the puzzle that, is falling into place. So, and only thing about homeless population, yes, we do definitely have a big problem with that, more than people realize, because people don't see it. And I know the homeless task force was working really diligently on trying to get a warming house, and and haven't been able to secure funds for that. They are still functioning though. They're trying to do some stopgap things in between at this point. They're providing like laundry tokens, to people so that they can go in. They get so many tokens, whatever, so it's not cash, it's not anything like that, but then they can go to the laundromat, they can get their clothes clean, they can, fold them up, put them back in their car, whatever. But I mean, so that task force is still up and running. You don't hear very much about it. Need some more key people to get into those roles on those task force. And there was a lot of concern, I know too, that we don't want to attract even more of a homeless population. So it was kind of like raise money, but don't really tell anybody, which is always a real difficult thing to do. But I just wanted to let you know that it is up and running, and they're still trying to do little things like provide coats and laundry tokens and that kind of stuff, even though they don't have an actual building, so.
All right, Health and Human Services report. There is not anything and no one here from Public Health. Youth Justice, there's a report attached. Community service updates, committee updates, I think we'll just wait on the rest until we have a quorum, unless anybody has anything for future agenda items. We will have the resignation of Judge Isham and reviewing the CJC bylaws accordingly at the next meeting.
I went to that tall cop presentation this morning and I took like 7 pages of notes.
Oh, good.
And I'd be willing to like type out just bullet points, just kind of the things to look out for, because his thing is like hiding in plain sight. These are things that are being sold in our community, right there in gas stations, and now I guess attaching themselves to liquor stores because alcohol sales are going down. So everybody's trying to make money. So I'd be willing to do that.
That would be great. Thank you.
Okay.
All right. With that, a meeting adjourned.
Yay.
People take my